I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video on restoring vision in herpetic eye disease. Now, herpetic disease of the cornea is actually one of the most common causes of corneal blindness in the Western modern developed world. It's very, very common. The problem with it is it's often diagnosed too late, and when it's diagnosed too late, it causes scarring, and scarring causes vision loss. Now, these people come in, they want to have laser vision correction. They can't have laser vision correction. What they need to do is have stability. But this little virus is a very, very tricky little virus, and it can do all sorts of things. And the aim is to get the eye stable first. I'll cover that in a bit later. But once you have the eye that's stable, and these people have usually unilateral corneal scarring, they often want to have better vision, and that's very reasonable. So what do? Yes, I have to go to surgery. In most cases, we can restore vision. Here you'll see the scar in the middle of the eye. There it is, I put a mark on it. It's all this irregularity. I try to keep the transplant here as small as I can. In this case, it's about a 7 3/4. And then on a donor punch, I'll still oversize it a bit because the scarring flattens the cornea. So here we go. You can see there's a blue mark there, and I've turned the central light off, but there's heaps of scarring as you saw previously. So this proceeds as per normal stromal transplant. I get down to the pre-decimase plane. Why is that? Because you just do not want to risk perforation here. Yes, you can get to decimase plane. It increases the risk of perforation tremendously. Pre-decimase plane, I think God gave it to us to do lamellar surgery. It's just beautiful. We can do all sorts of things with it, and you'll see me get down there. So here's this top layer going, and you'll see once it's gone, I then tidy up to make sure I'm in the pre-decimase plane, and I do a little bit of a clean up to ensure that I have continuity. And here you see that there. Little residual fibers I've removed, and it just peels away. It's beautiful. Incidentally, when I do this, I'm constantly changing the air in the eye. I don't leave. You'll see there's no air, very little air. There's a little bubble there in the eye, and that's the way I maintain my cell counts. I almost lose no cell counts when I do this sort of surgery. These eyes can melt. They can have lots of inflammation. So smaller transplant, I use about 8 cardinal stitches. And then I place the continuous. Now the continuous stitch is really important. The alignment here is critical. This video won't cover how I align the stitches, but just it's important to remember how critical it is. And stitching across 360 degrees is quite tricky to do. So here we go, and just tightening it up, and I remove all those cardinals because they don't do anything. There's no reason to have cardinal sutures. The continuous that I put there is all that is required. So I move it, adjust it, make sure the shape is as round as possible, and then post-operatively I will readjust it to get a nice shape and keep it in for as long as possible. And that's what it looks like at the end. So these people will be on the track and get their vision back. Now, the thing about this is that these people need to be stable. Never jump in for a corneal scarring. It's got to be stable for years. I always say about 5 years. The thing that's key is immune health, vitamin D level, making sure your immune health is sorted. Part of that plugs into mental health. So if you're a stressed person, constantly stressed out, you've got all sorts of family problems, marital problems, whatever, you're going to want to avoid surgery because you will flare up and cause all sorts of problems, and a melting transplanted eye is not fun. The other thing is low-dose topical steroids are required. And once you do have surgery, you will need long-term antiviral cover. But if you do all that, we can get your vision back. It works quite well. So that's what's involved. I hope that all makes sense. Yes, it is stromal transplantation with a plus. There's a whole lot more that goes from let's say a holistic point of view. So I hope that all makes sense. If you've got any queries or problems, you can always get in touch with us at the practice. Thanks again for watching. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney.